What's up, worldwide family? This one I just came across from the Washington Examiner. Doctors in Northern California say they have seen more deaths from suicide than they've seen from the coronavirus during the pandemic. This is by Andrew Mark Miller. Today is May 22nd, 11:11 a.m. Doctors in Northern California say they have seen more deaths from suicide than they've seen from the coronavirus during the pandemic. The numbers are unprecedented. Dr. Michael deBoisblanc of John Muir Medical Center in Walnut Creek, California, told ABC News about the increase of deaths by suicide, adding that he's seen a year's worth of suicide in the last 4 weeks alone. deBoisblanc said he believes it's time for California officials to end the stay-at-home order and let people back out into their communities. Personally, I think it's time, he said. I think originally this was put into in place to flatten the curve and to make sure hospitals have the resources to take care of COVID patients. We have the current resources to do that, and our other community health is suffering. Casey Hansen, a trauma center nurse at John Muir Medical Center for more than 30 years, says she's worried not only about the increased suicide attempts, but also about the hospital's ability to save as many patients as usual. What I have seen recently, I have never seen before, Hansen said. I have never seen so much intentional injury. Businesses across California have started defying stay-at-home orders imposed by Democratic Governor Gavin Newsom, and hundreds of protesters have hit the streets, making the argument that the orders were only meant to flatten the curve of the virus. I'm sorry, dear reader. I'm going to start it right there again. Businesses across California have started defying stay-at-home orders imposed by Democratic Governor Gavin Newsom, and hundreds of protesters have hit the streets, making the argument that the orders were only meant to flatten the curve of the virus's spread, which Newsom himself said was achieved in mid-April. Suicide has been an increasingly significant problem across the country as the coronavirus outbreak caused stay-at-home orders that led to unemployment and stress. By late March, more people had died in just one Tennessee county from suicide than had died in the entire state directly from the virus. A study published in early May suggested that the coronavirus could lead to at least 75,000 deaths directly brought on by anxiety from the virus, job losses, and addiction to alcohol and drugs. Another study conducted by Just Facts around the same time computed a broad array of scientific data showing that stress is one of the deadliest health hazards in the world, and estimated that the coronavirus lockdowns will destroy 7 times as many years of human life than strict lockdowns can save. Earlier this week, more than 600 doctors signed their names on a letter to President Trump referring to the continued lockdown as a mass casualty incident and urging him to do what he can to ensure they come to an end. So, dear reader, let me know what you think in the comment section below. I'll as always, put a link to this article in the description of this video, and that way you can check out the links to the stat from Tennessee, which I thought was interesting. Late March, more people had died in just one Tennessee county from suicide that had died the entire state directly from the virus. So there was a study published in early May suggested that the coronavirus could lead to at least 75,000 deaths directly brought on by anxiety from the virus. What is this study about? So I'll let you check that out. Thank you again for tuning in. Dear reader, more on the way as we keep you informed.